My name is Adelina Comazerre. I'd like to welcome you all to this LTCcovid webinar on unpaid care, on the impacts of the pandemic on unpaid carers. I'm just here to introduce, to remind you all that this is going to be recorded, and we're going to make the recording and the slides, if the authors are happy to do so, as a blog post in LTCcovid in the next week or so. So if there's anything you miss, don't worry, you'll be able to catch it, and you'll be able to also have access to the slides. I'd also like to mention that we've got another webinar next week where we will be looking at new models or rethinking of care homes post-pandemic. So that will be quite a different topic, but building up on all the work that's been going on in LTCcovid and reflecting about the impact of COVID on the long-term care sector. And then on the 8th of March, we're also going to be looking at the Nordic countries and at the impact of the pandemic on the long-term care systems in Sweden, Norway, Finland, and one more, Denmark, yes. So that's it from me now. Thank you very much, Klara, for organizing this webinar, and of course for leading all this amazing work on unpaid care during the COVID pandemic. Thank you.
Thanks, Adelina, and thank you very much to all these brilliant speakers who've agreed to talk today on this, what I think is a very important topic. And I don't want to take up much time. We'll be running sort of swiftly through the 6 presentations, which will all last at about 12 minutes. And after 12 minutes, I'll just give the speakers a sign if we're running over, just so that we kind of keep things a bit together. And we'll be starting with Jayeeta Rajagopalan, who will be talking about India. Then we'll be followed by Clarissa Giebel about a UK experience. John Perryman from Carers UK also giving a bit of an insight on the UK situation from the Carers UK perspective. Then Beth Russell will be talking about the American experience, and then we'll be hearing from Heinz Rothgang about Germany. And finally, I will be giving a very sort of short overview of a rapid review that we conducted here. And I think some of the papers that will be presented today have also been picked up in that. So I'll be very brief. But without further ado, I'd like to hand over to Jayeeta. And Jayeeta, if you'd like, you can share the screen yourself. If you prefer me to do it, please just let me know.
Thank you so much, Klara. I'll just share my screen. Yes. Is everybody able to see?
Yes, perfect. Thank you.
Thank you so much, Klara, and hello, everyone. So today I'll be sharing with you a study that we conducted here at the National Institute of Mental Health and Neurosciences that explored the experiences of family caregivers of persons with dementia during early phases of the COVID-19 pandemic in India. And just to provide you with a very brief overview, India currently has a population of 1.3 billion, and almost 10% of this population consists of individuals over the age of 60. And this is predicted to rise, as you can see from figure 1, to almost 19% by 2050. And currently we have approximately 5.29 million people estimated to be living with dementia in the country. And these numbers of people living with dementia is also expected to triple by 2050. And despite the rising numbers of people with dementia, only 10% of people with dementia in India ever get diagnosis, treatment, or care. It is the families that predominantly provide long-term care for persons with dementia at their own homes. And these family caregivers receive very limited psychosocial support. So as there was very little evidence on dementia and COVID-19 in many lower middle income countries at the time in which we had planned to do this study, we were really keen to understand the impact of the pandemic on persons with dementia and their caregivers in India. So during the time in which we conducted the study, the confirmed cases in the country were rising considerably. At the start of our data collection period in mid-May, there were over 112,000 confirmed COVID-19 cases. And by the end of our data collection period, in the end of June, there were almost 470,000 COVID cases confirmed in the country. And during this period, multiple measures were being taken to contain the pandemic. There was a nationwide lockdown that was initially announced on March 24th and which eventually extended up to May 31st, though there were phased relaxations. But it was only on June 1st, the country entered like the first phase of a 3-phase unlock plan after almost 2 months in lockdown. And considering our phase 1 data was collected during this period, the experiences that were shared by caregivers were predominantly in response to the nationwide lockdown and the restrictions that were in place at that time. So we did follow up with caregivers almost 4 months later and during phase 2 of our study. And this was in late October. And as you can see, around the time in which we had started phase 2, the number of active COVID-19 cases in the country were falling. However, today I'll just be focusing on our phase 1 findings. So the main objective of our study was to explore the impact of the COVID-19 pandemic on persons with dementia and their family caregivers in India. So today I'll be discussing our phase 1 findings, as during this period we had in-depth interviews with caregivers regarding their experiences in providing care during the pandemic, and I'll be sharing our qualitative findings predominantly with you today. So persons diagnosed with dementia and their caregivers were recruited from the Cognitive Disorders Clinic Registry of the National Institute of Mental Health and Neurosciences in Bangalore and the Neuropsychiatric Department of a local hospital in Hyderabad known as Asha Hospital in partnership with an NGO known as the Alzheimer's Related Disorders Society of India. And as you can see from the map, these are 2 cities in South India. And from the 152 caregivers of persons with cognitive impairment that we contacted, 104 caregivers of persons with dementia completed the study. And participants were interviewed via telephone only after we received their verbal consent. And prior to this, we developed a semi-structured interview guide, which covered a wide range of topics, including the challenges experienced, the changes in routines, the ability to access social and medical support services, the effect of the pandemic-related changes on the caregiver, and the measures that they took to adapt to this new normal. So, and then detailed notes of participants' responses were taken by our multilingual data collection team, and the data from the open-ended questions were analyzed thematically. In addition, we also evaluated behavior, severity of dementia, and caregiver distress by administering the neuropsychiatric inventory, the clinical dementia rating scale, and the depression, anxiety, and stress scale. This, along with all the close-ended questions, was analyzed using SPSS, and this data aided us in establishing a baseline, which we followed up on in phase 2. So almost 70% of participants fell under the middle socioeconomic bracket, and the majority were providing care for persons with Alzheimer's, FTD, frontotemporal dementia, and vascular dementia. There were other dementia diagnoses also, such as Parkinson's disease dementia and dementia with Lewy bodies. And the majority of caregivers, I think 103 out of 104 that were interviewed were primary caregivers of the person with dementia. They had been providing care for the duration of the person with dementia's illness, which was around 3 years. And as you can see from table 2, the caregivers were mainly the spouses or children of the person with dementia. And over half of these primary caregivers that participated in this study were women. So 4 major themes emerged from our thematic analysis. These were the unchanging reality of caregiving, the challenges experienced, the effect of changes on caregivers, and adapting to the change scenario. I'll be going through each one of these in more detail in the next few slides. So many caregivers highlighted that the pandemic did not really change their caregiving experience, as they felt that care provision during the pandemic was reflective of the consistent stressors associated with caregiving in general. So one caregiver said that from the time the diagnosis was made, I have forgotten that I have a life. I'm now running the house and also working. Similarly, another caregiver said that there's not really much of an effect, was not going well before, and is not going well now either. So caregivers felt that caring for persons with dementia had always been challenging, even prior to the pandemic, and that these challenges that they were experiencing were just continuing to increase. Some caregivers, however, went on to highlight the challenges they experienced during the pandemic period. And 2 main sub-themes emerged. So the first was the behaviors of patients. So some caregivers noticed changes in patient behaviors, mentioning increased irritability, confusion, and anger. So one caregiver said that he's predominantly an outgoing person, and then suddenly asking him to stay in the house and not go outside was very difficult. He was irritated and would constantly fight to go outside. And few of these changes in behavior were attributed to disruptions in daily routines that occurred as a result of the pandemic-induced lockdown and increased frustration among persons with dementia. And this caregivers found this very difficult to manage. And the results from our NPI also supported caregiver statements regarding presence of certain behaviors in persons with dementia, as we found that the most common behavioral symptoms that were reported were agitation, sleep disturbances, and irritability. The second sub-theme that emerged was access to care. So one caregiver said that it has been difficult to go to a hospital with monthly checkups being stopped and general checkups being impossible in the current situation. Difficulties accessing long-term care support services were also mentioned. So one caregiver stated that they were no longer able to go to daycare because services were temporarily suspended, and they were really struggling to find new ways to engage their relative with dementia. So as mentioned earlier, many caregivers had acknowledged that the process of providing care in general was associated with multiple stressors, but some caregivers highlighted that the changes in routine as a result of the pandemic-induced restrictions really aggravated an already very difficult situation. So one caregiver said that, "I feel a sense of isolation and a lack of support, and honestly, I think I'm out of words to even explain my situation." Similarly, another caregiver mentioned being unable to socialize, which really heightened feelings of loneliness and isolation. And our DAS 21 also revealed mild to severe depression, anxiety, and stress in a small proportion of caregivers. And it's possible that this distress is due to the stress that caregivers are just generally experiencing with caregiving. But it's also important to note that the pandemic-associated changes are likely to have increased the caregivers' distress as well. So despite the challenges that caregivers expressed, they did make multiple efforts to adapt to their changed scenario. The majority of caregivers had adopted some form of infection prevention measures, including masks, hand washing, social distancing, although few caregivers highlighted the struggles in enforcing such measures on persons with dementia who could not often remember or understand the need for such measures. Changes in roles and responsibilities were also observed by caregivers. Few caregivers mentioned that they were now able to spend more time with their relative on activities of daily living than prior to the lockdown period, but also mentioned that they were struggling to juggle their care provision and new work from home responsibilities. Lastly, caregivers spoke about their plans and strategies post-lockdown, and a number of caregivers mentioned that they would continue to maintain infection prevention measures, but also revealed an eagerness to resume outdoor activities such as visiting relatives, temples, going for walks. So in conclusion, it's really evident that caring for persons with dementia is complex even during normal periods. And the pandemic has only aggravated difficulties experienced by some caregivers, as well as highlighted the underlying gaps in our health and social care system that needs to be further addressed in order to reduce the impact of the current pandemic on vulnerable populations, but also improve our responses to future such emergencies. And as majority of dementia care is provided by family caregivers at their homes in the Indian context, there is an urgent need for more strategies and services to be developed that can provide support to caregivers at their own homes, in addition to care being developed and being provided at institutional settings. So a multidisciplinary approach involving medical, social, public health, and policy spheres is essential in order to meet existing caregiver needs and also to facilitate the reframing of existing models of dementia care services in the country. So that's all from me. Thank you very much, everyone, for listening. I'm just going to stop sharing now.
Thank you so much, Jayeeta. That was really interesting. Very great to get such a detailed insight into the situation in India. And yeah, thank you for sharing it with us. If you have any questions, perhaps you could put them in the chat or sort of hold them for now, and then we will have some conversation after and discussion after everyone has presented. And so I will just hand over and give the floor to Clarissa, please. Thanks, Jayeeta.
Yeah, thank you very much, Klara and Adelina. Thank you for inviting me. So just going to do that awkward screen sharing now. And here we go, which you should all hopefully see. Yeah, cool. Not from Klara and Adelina, super. Yeah. So my name is Clarissa Giebel. I'm a research fellow at the University of Liverpool and the Applied Research Collaboration Northwest Coast. And today I'm going to share with you a little snapshot of all the work that's been going on led at Liverpool on the impact of COVID-19 restrictions on the lives of people living with dementia and unpaid carers. So we've done work both on community residing people living with dementia as well as care homes, but for now, for this talk, I will specifically focus on our community-based work. So we wanted to understand how the restrictions have impacted on accessing and using social support services, specifically for people living with dementia. So when we talk about social support services, we've spoken to service providers and clinicians, what that actually entails to make sure we really capture all of it. And what came out was we're looking at daycare centers, respite care, peer support groups, singing and dancing groups, for example, so generally social activities in the community. Could be walking groups or going to the pub. But it's not just activities that you go outside for, that you leave your house for, but it's also activities or care services where people come into your own home. So that's paid home care, but it could also be, for example, meal deliveries or befriending services. So someone comes into your home, sits with you for an hour or two, has a chat, and gives that carer a little bit of a respite to do things in their own time. So restrictions in place, we're not supposed to see anyone, we're in lockdown, we're not supposed to be close to anyone. So how does that impact on the really important care? We do know from before COVID that engaging in social activities and generally social engagement is linked to improved quality of life. So how does that impact now? So what we did a two-part study. We conducted both qualitative interviews and we ran a longitudinal survey. Already in April, we conducted 50 qualitative baseline interviews with unpaid carers and people living with dementia. And so the people living with dementia all had capacitative consent, so we're more in the earlier stages of the dementia. And we asked people over the phone or over Zoom if they wanted to do it via the computer, what are their experiences of these restrictions in accessing care? And how are they finding the lockdown? How is it impacting on their day-to-day life and on their caring responsibilities? That was in April. So in the UK, we had nationwide lockdown on the 23rd of March. And then we decided, okay, things seem to be moving and changing quite quickly in terms of restrictions. And I suppose now it's nearly a year now. And so much has changed over the last year, how restrictions have been amended, imposed and eased again. So we wanted to understand 3 months later, how have things changed? So in June, July, we conducted some follow-up interviews. So these few quotes, these findings are only from the baseline interviews. That was April. That was only a few weeks after nationwide lockdown was imposed. And already then, many carers were noticing a much faster deterioration of the person with dementia's symptoms. So cognitively, they seemed to deteriorate much faster, and they were really concerned, would they come back from this? So it's not just not accessing the services, so not getting that social stimulation, but being restricted to the own home, not really going for walks maybe anymore, not going outside, not getting that cognitive stimulation of engaging in any tasks. That seemed to have led to these faster deteriorations early on. And that came with a huge level of uncertainty. Would the relative with dementia be able to go back to those services, to the daycare centers, to the support groups, once they would reopen again, if they are deteriorating so much, so quickly? But also it's about the services themselves. People were just so unsure, when are the services resuming? Because they were taking on all that additional burden. Well, I can't send my father to the daycare center. I now have to pick up those additional caring hours. So a huge level of uncertainty surrounding these services and accessing them in the near future as well. And then also this big theme of adapting to the new normal. So what we've noticed, we've interviewed people both with Alzheimer's disease dementia and rarer dementias, and carers from both sides, basically, the more common and the more rare dementias. And one thing that was noted as well was that some people with dementia, some types of dementia, have vision issues like PCA or Lewy body dementias. So if you imagine you're looking at a Zoom screen and you see those tiny little boxes of people, but some people with dementia struggle recognizing these people as opposed to being in a support group face-to-face and seeing them. So that was a barrier to accessing care and services. But then many people with dementia are elderly as well. So they don't necessarily have that technological know-how in setting up Zoom, setting up these remote services, if they were even available. And they didn't really seem to be available early on. So suddenly pandemic comes and the support just seemed to be completely cut off for the majority of people. One type of support service that seemed to be sticking out a bit in terms of it was a bit different, differently accessed, was receiving paid home care. So on the left side, pre-pandemic, elderly ladies being cared for, has a hug from the carer, totally normal. On the right side, that's the new normal now, having paid home carers come in, wearing full PPE, gloves, visor, apron, all these things. But so we wanted to understand in those interviews, do you still receive paid home care, or how has it changed if you do? And one thing to note, at least in the UK, is that someone could receive a number of different home carers a week to come in. Could be 7, 8, 9 different care staff come in. And with that comes an increased risk of virus transmission. So unpaid carers faced really difficult decisions in terms of, do I continue having these outside care staff come in on a daily basis, possibly bringing in the virus, or do I cut off this support and pick up these additional caring duties myself? So quite a few decided, no, we're going to stop this. We're too concerned that care staff might bring in the virus because they don't know whether they really adhere to those restrictions or not, or they pick it up on public transport on the way to work. But those carers that decided, no, we don't want any more care staff come in, they had increased levels of burden, and because they had to care additionally for their relative with dementia. And there seems to be a tendency in our follow-up interviews as well that we noticed that where paid home care was stopped because of these worries, that possibly people with dementia were entering a care home sooner as well, because the unpaid carers seem to be too burdened by this, understandably. But then there were other types of unpaid carers who said, I just can't cope on my own. I need to get those care staff come in. I'm very much aware of the risk, but I just need to have that support. And one thing on that note as well is that there seemed to be, now again, that was April, there seem to have been very different experiences in terms of using PPE by home care staff. So some were wearing gloves, some were wearing masks, some were wearing nothing. So I'm sure that hopefully has changed now, also considering there's better access to PPE, I hope. But back then, there was no guidance what to wear, and access to it seemed to be a bit more limited. Here's just a quote to illustrate that inability to cope without those paid carers. So this daughter particularly was really grateful that people were still coming in and doing these duties. So as a complementary piece of work, we conducted a UK-wide survey, and there is so much more I could tell you about it, but I'll try and do it really briefly and summarize it. So what we wanted to do, we did an online and telephone survey, because we are aware that some older people who are receiving care don't have access to the internet. So we did the same survey over the phone. And we conducted the survey at 3 time points. So time point 1 was at the height of lockdown 1, time point 2 towards the end where lockdown 1 was easing, and time point 3 was when restrictions were quite much more eased and shielding was stopping soon as well. We wanted to understand the types and levels of social support services that people were accessing and have accessed pre-pandemic, but also the levels of well-being, so anxiety, depression, quality of life. So overall, we had around 400 people who completed all 3 time points. And just, so this is an overview of the most accessed services pre-pandemic. So on the left, furthest left bar, the light gray one, you see how many people of the whole sample was accessing paid carers, support groups, daycare, social activities, befrienders. And you see this huge drop at time point 1, so a few weeks after the pandemic, after the lockdown. And only, it seems, paid carers and support groups were starting to go up the usage a little bit again over these few months that we followed them up. But I suppose we can imagine, how are you going to conduct daycare remotely, or even during the lockdown? That's just support groups you can do remotely a little bit, but it's just kind of really to illustrate the sharp decrease of social support service usage. And just towards the end as well, to link up with mental well-being. So reduced levels of social support service usage was linked to higher levels of anxiety in people with dementia and older adults. But reduced levels of social support services was also linked to reduced mental well-being and reduced quality of life. So it's really a stark illustration of how important these services are, and we need to support people living with dementia and carers in the community better during the pandemic. So just kind of to summarize some of those implications so far, remote service gives some benefit, but it's just not the same. And from those interviews and the survey that was done back in spring, summer last year, it's kind of illustrating face-to-face support should be enabled where possible, but there also needs to be much more guidance how that could be done safely. And it's based on each individual whether they want to take part in this. And just last one, we're also now we have collected data in Australia, Italy, Poland, and India. So we're just comparing these findings now, how each different cultural setting has been impacted on. And that's it from me. Just to thank everyone who was taking part.
Thank you so much, Clarissa. That was so interesting. And yeah, thank you for sharing those very interesting studies and excellent timekeeping as well so far. So that's great. And I think we'll just, given that we have so many speakers and we want to move through and get time for everyone, I'll just hand over to John Perryman now, who will also be talking about the UK from a Carers UK perspective.
Thank you very much, Klara, and thank you very much for inviting me today. Let me just grab my screen. Can everyone see that? Okay. Fab. Hi, so thank you very much, everyone, for inviting me today. It's great to see so many people here. I'm John Perryman. I'm the Senior Policy and Public Affairs Officer at Carers UK. In the next 10 minutes or so, I'll be talking about the impact the COVID-19 pandemic has had on unpaid carers generally in the UK, the support that has and has not been put in place to date by governments across the UK, and finally, the priorities for carers as we emerge from the pandemic. Firstly, let me just say a little bit about Carers UK. We are the UK's only national membership charity for carers. We have over 20,000 members and growing all the time. We describe ourselves as a supportive community and a movement for change. And we've existed in various forms with a couple of name changes over the last 50 years. But across that period of time, we've been driven by carers raising their voices together to call for change and for greater recognition and support. And our kind of call to action is we want a society that recognises, supports and values all unpaid carers. So over the last 12 months or so, we've been conducting a number of pieces of research into the impact of the COVID-19 pandemic on unpaid carers in the UK. This started in April when we produced our first Caring Behind Closed Doors report, which was based on responses of just over 5,000 people to an online survey. In June, for Carers Week, Carers UK runs a national campaigning week called Carers Week each June, we produced a report which estimated an additional 4.6 million people had started caring or had identified as a carer for the first time in the first few months of the pandemic, taking the total of carers in the UK to 13.6 million by our estimates, which is 1 in 4 adults, up from 1 in 6. Then in October, to track how the pandemic was affecting unpaid carers, we conducted a second Caring Behind Closed Doors report, again based on an online survey of at that time around 6,000 survey responses. And then finally, in November, we produced a report looking at the value of unpaid care that had been provided by carers during the pandemic. And that report estimated that carers are providing £530 million worth of unpaid care each day of the pandemic, with an annual value of 193 billion. So let me just dig a little bit further into the findings that we got from our first report in April. The first thing to note is the pandemic has had a profound impact on carers' lives. 70% of people are providing more care, on average providing up to 10 additional hours of care per week. The reasons for that, according to our findings, were over a third of people are providing more care as a result of local services reducing or closing, as Clarissa's just talked about. And secondly, the majority of people are feeling overwhelmed and burnt out. That was 55% of people who responded, so showing the impact it's having. 69% of people were providing more help with emotional support, motivation, or keeping an eye on or checking in on the person they care for. 81% of people are spending more money, 72% of people spending more money on food, and 50% of people spending more on household bills. And really worryingly, 87% of people are really worried about what will happen to the people that they care for if they themselves can no longer provide care. So in tracking that over the next 6 months, in October, our second Caring Behind Closed Doors report continued to show that the pandemic was making, carers' lives really more difficult than it had been pre-pandemic, and many were having to make extremely difficult decisions about both work and their family lives. The two kind of takeaway findings: carers are having to provide even more care than they were 6 months ago. So 81% of those 6,000 people said that they were providing more care, up from 70% in April. Again, that was due to local services being closed, but also because needs have increased. And that was the second key theme that came out of that research. 78% of people said that the person they care for had seen their needs increase. And that had a severe impact on both the amount of care people were providing and just a carer's general life. 58% of people said that they felt more stressed, and over half had said it had a severe impact on their own personal health and well-being. And a key reason for that was carers found it very difficult during the pandemic, as Clarissa was just pointing out in her presentation, to access services and vitally to get a break from their caring responsibility. So 2/3 of carers said that they hadn't been able to take any breaks at all since March 2020, when the pandemic first started, and 1 in 5 said that they hadn't been able to take as many breaks as they felt they needed, giving a combined 4 out of 5 carers saying that they hadn't been able to have any or sufficient breaks. So I'll not touch on all of these in too much detail because I've just talked about the first 2, but across those 4 reports that we have produced, it's clear to us that a number of themes are emerging. And whilst many carers in the UK had really difficult, responsibilities pre-pandemic, it's very clear that the pandemic has made a lot of those areas much more difficult for carers on a whole range of fronts. The first one, as I just talked about, the changing nature of care, so increased needs, having to provide more care. Secondly, the lack of access to breaks and services. And then thirdly, I will talk in a little bit more detail about health and well-being. So as I was just mentioning, 64% of people said that their mental health has worsened. 58% of people have said that their physical health has worsened. And some other measures around health and well-being, only 43% of people said that they've been able to maintain a healthy diet. A lot of carers have had to rely on food packages that have been provided by the government. And as Marcus Rashford's campaign highlighted, if any of you saw that, the inadequacy of some of the food packages that have been provided to both children and to other users of social services. 70% of people had said that they had to reduce their physical activity, and half of people said that they felt really lonely and cut off from others. The fourth theme that's really clearly emerged is financial pressure. So again, pre-pandemic, this was an issue that affected many carers in the UK. 1.2 million people in providing care in the UK were living in poverty pre-pandemic. But our survey responses show that this has got worse. 28% of people are struggling to make ends meet. Over 1 in 10 had been or were currently in debt as a result of caring. 26% were spending more due to COVID, as I just talked about. And quite worryingly for us, worryingly, but probably quite obviously, those who are in receipt of carers allowance, which is the main benefit, social security benefit for carers in the UK, were the most likely to be struggling to make ends meet. And then finally, the impact on working carers. So as services have been reduced or closed, many carers have felt they basically have had little choice but to either reduce their hours at work or to quit work entirely. And we knew that this was an issue pre-pandemic again. Our previous research showed that up to 600 people a day were having to leave the labour market entirely to care pre-pandemic. But according to our survey, 11% of carers had reduced their hours, and 1 in 10 had given up work since March 2020 to care. I will briefly say a few words on some research that our friends at the Alzheimer's Society have conducted, looking at the impact of those caring for people with dementia in the UK. Echoing again what Clarissa said, a lack of dementia-appropriate services are available. A minority of carers who are caring for someone with dementia have received a carers assessment, which they're entitled to by law under the Care Act 2014. Many carers talked about how their wishes around both their own personal working situation and their personal life more generally weren't considered if they had received a carers assessment. And this had led many to talk about a loss of identity. And I was struck by, Jayeeta, your presentation where you talked about people feeling that they didn't have a life anymore, and that's very much echoed by many carers here in the UK. And finally, lots of carers talking about how they wanted more specific guidance and support for caring for people with dementia. So I'm just briefly now going to touch on some of the things that have and have not taken place to provide carers with more support during this really difficult time. So firstly, what did happen and what governments and others across the UK have put in place. So we were really pleased to see that carers were included in the priority list for testing, although it took a bit of time, it did happen eventually. We were pleased to see early guidance for unpaid carers regarding how to deal with the pandemic and how to care for people safely. With regards to work, we were very pleased to see that carers were eligible to access the furlough scheme that was put in place by the UK government. And they also provided lockdown exemptions for unpaid carers to enable them to care for people if they weren't living with them, which was a real worry for many carers at the start of the pandemic when there was lots of confusion about what was going on. In terms of supporting the return of services, the UK government put in place something called the Infection Control Fund, which was 2 rounds of over £500 million worth of funding. And whilst that was really beneficial and has helped the situation in the UK, it came too late. In terms of financial support, there's been an additional carers allowance supplement, but only for carers in Scotland. So we're pushing very hard to see that introduced across the UK. And also in Scotland, carers were provided with PPE. And we're really pleased, finally, to have seen that carers have been given the priority access to the COVID-19 vaccine, and as of today, are being called forward in Priority 6. However, there has been a lack of PPE for carers, and again, not to keep harking back to Clarissa, but this did lead to a lot of carers withdrawing from services and feeling like they couldn't allow paid care workers to come into their home because they were so worried about infection control. As I mentioned, the lack of specific financial support for carers in England, Wales and Northern Ireland. closure of care services and the lack of respite support has had a huge impact and continues to do so. I think one, I'm not sure how this plays out in different nations, but in the UK, there's a real lack of understanding of carers and the role they play in providing care by the National Health Service. There's a disconnect between the NHS and social care often, and carers kind of fall between those cracks. Often feel like they're not consulted, for example, on hospital discharge, and that's obviously been a particularly key issue during the pandemic, with people very worried about people going into care homes. And finally, a lack of visiting in care homes has been very difficult, both for carers but also the people that they care for. So the final bit for me, what do we see as the priorities for carers now and as we emerge from the pandemic over the next year or so? Firstly, making sure the rollout of the vaccine happens as quickly as possible to all carers, as I just said, starting from today. And we're very pleased that they have been given priority access. And we want to see as many carers come forward for that vaccine as possible. Secondly, breaks and respite support. Sorry, bear with me. It's absolutely vital that the government urgently reviews break services in the UK for carers and invests in them. And I thought it was very interesting to see that the Association of Directors of Adult Social Services recently called for a £1.2 billion investment from the government to allow carers to take breaks, and that's a call that we'll be supporting and pushing hard for over the next 6 months or so. Next, financial support. So we're looking for a supplementary payment to be given to all carers who receive carers allowance or have an entitlement to carers allowance, and that would match the increases that other benefit recipients have seen in the UK, such as those on universal credit who have seen an extra £20 a week support, which works out just over £1,000 a year. We want to see more measures to help people juggle work and their unpaid care responsibilities. That includes both a right to flexible working, not just a right to request flexible working, and also the introduction of 10 days paid carers leave from work. Fifthly, we want to see a duty on the National Health Service to recognise and support carers, giving them a statutory duty to do so. And then finally, looking more to the longer term, we're arguing really strongly for carers to be at the heart of social care reform. And I don't know how much people know about this, but across the UK, social care system since about 1997 has undergone about 20 different reviews by government, but they've never actually got round to implementing reform. So we're really hoping to see both a reform of the way the system works, but also much more investment in that system. And we believe that carers need to be absolutely at the heart of that system. And then to help carers as we emerge from the pandemic, Carers UK are calling for a new deal for carers. Whether that's a cross-departmental government action plan or strategy, we feel like a real focus needs to be given to carers. Anyway, that's enough from me.
Okay, perfect. Thank you very much. That was really interesting. Thank you for giving us a tour of the important work that Carers UK have been doing during the pandemic. Yeah, I think we've got a great overview of situation in the UK, even though it's the situation clearly isn't great. But I think now we're jumping over to the US, and I will hand over to Beth Russell. Beth, are you there? Would you like to share the screen, or would you like me to take over?
I am here, thank you. I'm happy to share my screen. So thank you for inviting me to talk with you today. My name is Dr. Beth Russell. I'm an associate professor at the University of Connecticut and director for the Center for Applied Research and Human Development there. I'll go ahead and also thank my many brilliant colleagues at the university, including Dr. Crystal Park, Dr. Michael Fendrick, Dr. Rachel Tandling, and our brilliant team of pre-doctoral research assistants. There are two projects that I'll be presenting some data from today from the United States, but I thought I'd give you a quick peek at what's happening here. Today, if you look at by county rates, you'll see that COVID is clustering around our urban centers, but not quite as much as we would have expected or that we saw earlier in the pandemic in 2020. I think it's relevant to talk about why I'm going to talk at the county level, because many of our COVID responses were initiated at the state level. So we had 50 different responses to the pandemic led by governors, but even within each state, we saw pretty dramatic variability about how different policies were enacted. So for example, if we look at mask wearing in the United States by county, you can still make out the outlines for our 50 states here, but more to the point in terms of variability is these contrasts that you'll find even within a given state, where you see municipal changes in how well guidelines were communicated and then adhered to by the public. So I'm over here in Connecticut, one of our smallest states, and the two studies that I'll be giving you a peek at today are from 2020. We surveyed the national public through online surveys starting shortly after the first widespread community responses to COVID-19 here in the States. Our first US death attributed to COVID-19 was in February, and within a month, we start to see some community widespread responses, but again, a lot of municipal differences that led to confusion and inconsistency in both preventative behavior, but also an understanding of what kind of supports were going to be available as the pandemic rolled on. So one good example of that is that here in the United States, the end of our public school year is usually no later than the middle of the month of June, although there are some states where you'll see the academic year ending is as early as the first week in May. Now, here in the States as well, our social services are connected to our public school system in important ways. So especially for disadvantaged communities, many medical, dental, social service, even meals for disadvantaged families are provided through the schools. So when a municipality had to consider whether and to what extent to move to reduced capacity in their physical buildings or to close them entirely, changed access to a really important network of supports for families across the spectrum. It wasn't just about education. And as I mentioned earlier, because we have many municipal decisions happening within a state, you might find that just a few miles apart, two different schools were approaching service administration differently during the pandemic. For example, here in my very small state of Connecticut, we have 130 school boards that each individually decided how to, whether to, and for whom to shift to virtual or hybrid modes of operation, starting as early as March. So the two surveys we did collect data at some interesting time points relative to those markers. The first was a baseline survey of the national general population that ultimately reached over 1,500 individuals. We surveyed the week of April 7th. We would later come to learn that here in the United States, infection rates peaked April 10th. So we have baseline data from the first spike in COVID activity here in the United States. Then 30 days, 60 day, 90 day, and 180 days later, 6 months. A little side note, our general election to a new administration took place the same week as our 6-month data collection. So as we were studying mental health and stressors, we saw very interesting, shall we say, co-occurrences of stress in the public for those time points. The second study is focused on informal caregivers of minors. We only have 2 data points there in a smaller sample, but again, it gives us a much tighter focus on what the caregiving experience was in the United States, straddling this important moment when schools were shutting down and access to services became quite limited, and the end of the public school year where families would have even fewer access to resources for an indeterminate period of time, because certainly back in May, we had no sense of what the fall would bring and whether those services would be back online for families. Okay, so the first study I'll be presenting includes data that's already published from last year. So you can find many of these findings I'll kind of try and keep this pretty short, but I think it's important because this is the larger longitudinal study that inspired the smaller study focused on caregiving experience. So results from an early cut of these data, we saw our numbers hit about 1,000. And so I went up to the data portal and pulled down the first cut of 1,000 cases just to see if we were seeing trends in a couple of important subgroups. To me personally, of course, as caregivers, so I'll present to you today what we saw. We knew that the high ambiguity and the limited opportunity for control for caregivers tends to lead to disproportionate psychiatric diagnoses here in the United States for informal caregivers and formal caregivers, particularly anxiety disorders and post-traumatic stress rates are higher amongst these groups. The data echoed that. We saw statistically significant differences in stress appraisals relative to COVID specifically, as well as the disproportionate impacts on disruption to daily routines that some of the other presenters have talked about today. This having much to do with for my interest in self-care, that caregivers were reporting far more disruptions to how they care for themselves, in particular their coping skills. And interestingly, we saw concerning trends in those coping styles, excuse me, over time. I'll talk a little bit more about those specifically in just a moment. When we looked just at the caregivers from the larger sample that we eventually accrued within 2 weeks of that first baseline cut, we see that over 20% of them were scoring above clinical cutoffs for post-traumatic stress disorder over just a short period of 60 days. So that's rather quick and fairly alarming for us. The majority of those above the clinical threshold were female, and all of them reported significantly higher rates of COVID-specific stressors and specifically substance use to cope and behavioral disengagement to cope, with fewer active coping strategies in evidence for this group compared to their non-caregiving counterparts. These data are currently under review. We're hoping they'll be out probably within the next 2 months if the kind editors and publishers treat us nicely. Last little bit of data from this first study. We have linear stepwise regressions that clearly indicate to us that this post-traumatic stress across types of distress are really driven by anxiety more so than by other things. Surprising to me, we did not see consistent effects for depression symptoms, nor for the particular socio-demographic indicators of vulnerability that we commonly find. For example, single partner status and having good social supports in the home, or even income. So clearly I was very interested in what would happen if I were looking more closely at a larger group of caregivers specifically. This is the second study. These results are also published in a 2020 publication that I think will be shared with you all later. 420 individuals, again, filling out surveys for us at multiple time points. This time focused much more closely on mental health and relational factors. I was interested generally in whether or not caregivers were regulating their distress in ways that influence their perceptions of their relationships with their children. You'll see we've got 2 measures of that through conflict and closeness, as well as a few relational factors tied into our measure of caregiver burden. All of the correlations moved in expected directions, and some of them were quite robust. So we were interested in exploring these a bit more to see what group differences we could elucidate. Today, I'm going to focus on just a pattern that we saw when we looked at the gender by caregiver. The men in our sample were clearly expressing higher levels of depression, perceived child stress and caregiver burden, and relative to this particular publication, they were reporting higher impacts of conflict with their children over time. So when we sought to explore this a bit more, we took a multi-group path modeling approach. And I've shared on the screen with you just the side of the model that looks at the men's data. And I've highlighted the unique path that we did not see shared by female caregivers. Men were more likely to report an indirect effect of caregiver burden through depression onto that conflict finding that was quite high for them. So a quick couple of discussion points. We know that caregivers in both samples were experiencing high levels of distress over relatively short periods of time. Mental health symptoms are concerning, particularly the post-traumatic stress indicators. I will say that the specific form of distress that I'm seeing rise the fastest is in intrusive thought. And that seems to be even more disproportionate for women than for men. But interestingly, it's the men who were reporting stronger impacts within their relationship for their children during this time period. So there's a bit of a summary here about that indirect pathway that we were seeing reported from men through their depression. A couple limitations to these data. We don't have pre-pandemic data. It was in fact, we are collectively teams of mental health researchers who saw the pandemic unfold in the United States and thought, well, this is pretty chaotic. 50 different states responding, all of the municipalities within each trying to do their own best thing. And then of course in November, a new administration elected with a far more coherent message about a COVID response made us kind of wonder what would happen. And so we took it one step at a time. And of course we are all entering our year mark with COVID, which none of us would have expected back in March. We all thought, oh, surely by September we'll be fine. No. In fact, we're collecting 2 more waves of data as a result of the ongoing struggles. So if anyone's interested in getting a little United States perspective, please do reach out. We're quite collaborative in spirit. We are paying quite a bit of attention to the high ambiguity and limited opportunities for control that caregivers are facing here in the United States, particularly those that are reliant on our public federal systems of providing both social and educational supports for families with children. I do want to note that we do not have much child data in these data sets. So for example, we don't have chronic health status for the children or much about whether or not there are disabilities. And we certainly know that those are huge factors in predicting the mental health impacts for their caregivers. And with that,
thank you. Oh, sorry, you were finishing off.
Yeah, perfect. Just send a wish.
Sorry.
We get better at coordinating our employment, school, childcare, and other resource disruptions. They are clearly having an impact on the mental health of our care providers. And with that, I will just say thank you.
Thank you so much, Beth. That was really interesting. Great to get this perspective of the US, but I think also very interesting to have a slightly different population of carers and to see what's going on there. Thank you very much for joining us today, and I hope you can stay for some more questions later. But I'm now handing over to Heinz Rothgang from Germany.
Okay. Yeah, thank you very much for inviting me to this seminar, and I've listened to very fascinating presentations, and I've seen a lot of things, a lot of issues that also came up in Germany, and I think pieces fall nicely together. What I want to present you today is some information about the first wave of the pandemic. And as you can see on this chart, the first wave peaked on about March. If we will look at the number of newly infected, or it would peak in about April if we think about the number of deaths. And you can see here in Germany the second wave that started in October, and we're still in the second wave, though at the moment it's declining. And some of us think that it's only before the third wave starts, but that's another story. So what I want to tell you is about what we found out about the first wave. And if we think about data, and I've seen very fascinated a lot of data here for other countries, we do not have a lot on unpaid caregivers in Germany. Actually, the official statistics doesn't cover this group. And we do not have a lot of surveys on that, neither. And basically, we concentrated in Germany on hospitals. Then if we managed to go beyond hospital, it was long-term care nursing homes. And even for home care providers, there was a little attention. And if it comes down to informal caregivers, they don't play a big role, and they are no priority group for vaccination or things like that. And actually, there are, so to say, a kind of a forgotten target group if we talk about COVID-19. So what I really refer to is 2 surveys that we conducted ourselves at the University of Bremen. The one survey is about professional providers, and we had a survey on nursing homes, as well as on service providers for home care and daycare. And the second survey, which is the one I refer to most of the time, is about a survey on caregivers aged 67 or less. We cut the age group at 67 because we wanted to have caregivers who could still be in the labor market. And that's why we concentrated rather on the younger caregivers, not on the 80 and 80-something year olds. So these are the 2 surveys I will refer to, and both are not representative surveys. They are convenient surveys, but they are quite representative with respect to some dimensions that we could check later on. So they are quite okay, though they are not representative. The basic thing that we found from the survey from the professional providers is, and that's something we have heard before in this seminar, is that we've seen a cut down in professional services. And we have seen that due to 2 points. On the one hand, professional service providers couldn't offer as many services as before because their staff was no longer available. They were in quarantine and isolation. They were they had to care for children because the childcare facilities were shut down, etc. So the providers couldn't offer as many services as before. And on the other hand, the customers didn't demand for those services due to some fear that they would get some infection from the service providers. And as a result of that, from our professional care providers, they said, half of them said that amongst their customers, there were some households where it was quite clear that caregiving was not guaranteed during the pandemic because live-ins, that people from Middle and Eastern Europe most of the time that live in the households, they returned to Poland, Romania, Ukraine, or wherever. Service providers no longer were there at the same amount. So we had some critical situations. And that's what we could learn from this survey. If we turn to the other survey, the survey of informal caregivers, we see, let me start with something that's quite interesting. 2/3 of the interviewees were satisfied with the government policies on COVID-19. That was in the first wave in April and May and partly in June. That would be different today, but at that time the satisfaction with the government was quite high in the general population, but also in this particular target group, though, as I will show later, they were not satisfied with particular measures for them. So they were not satisfied with measures to help informal carers, but they were satisfied with the policy in general. And that's some figures you can see. 60% were satisfied. About 60% of the caregivers realized a change in the caring situation. That means, you see it here, 60 to 40. Though the rate of infected people among caregivers and also cared for was fairly low in the first wave. The majority experienced the differences and changes in the caregiving situation due to less utilization of formal caregivers. And that was reduced both due to supply and demand effects. And you can see that here. I'm sorry, all the slides are in German because I couldn't translate that quickly. But you see the figures here, the bottom one, the upper figure is the reduction due to the supply side, and the lower figure is the reduction due to demand side. And you have different kinds of services. And you see in each of them, there's a clear reduction. So the picture is informal caregivers could rely on less professional help than before. And informal caregivers suffered from lack of protective material, particularly at the beginning of the pandemic. That's what we found also in the professional caregivers. They had a lack of masks, of gowns, of sanitizers, and that was even worse for informal caregivers. And here you can see in these blue colors, it's the darkest blue is they had a lack of that daily. The second dark one is 3 times a week, and the third one is once or twice a week, and the next one is less frequent. But so if you think about all the people that lacked these protection devices, it was more than 80% at the beginning. And we also asked in the last week before the survey, that means there was some weeks later on, and then you can see it decreased in all types of devices here, considerable, but still a majority was lacking some of these materials, even in the last week of the survey, which means during the first wave, we can assume that there was a real lack of protective devices. The interviewees all complained about, or not all, but the majority here, you see 71%, they say that they have more problems with the compatibility of gainful employment and caregiving. The interesting thing is they were also asked what they think about the role of their employer, and they said the employer is quite okay. You can see here they were very satisfied, that's 36%, or satisfied, that's 29%. So that's, let me do the calculation now. It's 2/3 of the interviewees said they were satisfied with their employers. The employers did what they could. Nevertheless, 70% said we had a big problem with the compatibility of gainful employment, which what we have to do there, and our caregiving tasks. So that was a major problem. As a result from all that, the self-rated health status deteriorated for half of all caregivers. That's the self-rated health status here, and you see considerable deterioration, that's 11%, some deterioration, that's 41%, and 47% say nothing changed, nobody's had anything improved. So half of the interviewees said their self-rated health status was worse due to the pandemic. And you can also say the share of caregivers who felt lonely increased from about 1 in 3 to about 1 in 2. Loneliness for caregivers, of course, is a very serious problem anyway, all the time, because they feel they cannot go outside, they are trapped in their role as a caregiver. But that also increased considerably. Here you see from 33% to 51% of those who responded. Which means, in a nutshell, what do we found? What did we find? Only a very small share of the respondents say that they have been diagnosed with SARS-CoV-2. That means at that time, when we asked in the first wave of the pandemic, it was only a minority of caregivers and cared for that really had the virus. But nevertheless, more than half of the respondents reported that their care arrangement has changed due to the pandemic. And that was due to supply and demand side effects. More than 2 out of 3 caregivers reported a deterioration of the reconciliation of gainful employment and caregiving. And the government did something about that. So for example, we have a 10 days leave for organizing care, and that was increased to 20 days. But it didn't help very much. So the government measurements, by and large, didn't have a big effect on the informal caregivers. As a consequence, the first wave of the pandemic has had negative effect on self-rated health, on quality of life, and it increased the feeling of loneliness. So we clearly see the negative effects. And although informal caregivers, as said before, support government's measurement in general, they do not feel recognized sufficiently in their role as caregivers. And as I've mentioned before, that's even true today. We do not have a lot of specific measures for informal caregivers. They are not a priority group. All the inhabitants of nursing homes, care homes, they are first priority group when it comes down to vaccination. Informal caregivers are not mentioned at all. So in the first wave, and I think that's still true today, informal caregivers are in a way a kind of a forgotten group when it comes down to dealing with COVID-19. Thank you for your attention.
Thank you very much, Heinz, for giving us this very interesting perspective of the situation in Germany. What I'll do now is I will give a very brief presentation just on what we did a rapid review of the literature of adult carers. And I don't want to take much time on it because I want us to have a bit of time also for a conversation. And let me just see, can you see the screen? Perfect, thank you. So we looked at the impacts of COVID on unpaid carers of adults with long-term care needs. And we looked also at unpaid carers, at adult carers specifically. So we did a rapid review and really we're trying to capture sort of between June and November of what's been happening since the beginning of the COVID-19 pandemic for these people. So we searched a range of databases, grey literature, and also what came out as part of blog posts or reports in the LTCcovid network. So I won't stop long here. We found evidence from 10 countries. Most of the evidence was quantitative, but there was also some qualitative and mixed methods data, and most of the evidence also came out of academic research, but the voluntary sector has also played a role. And you will find that some of the things that will be picked up on those slides actually a lot of the previous speakers have talked about, and I don't really want to go into detail on those, but I think there's a couple of things that have not perhaps come out as much in this research that we found as part, and I just thought that might be a good addition. So when we go into the conversation. So it was mentioned from all the speakers that there were changes in care responsibilities, that most people increase their care commitment, but for some it's less because they can't travel to the people that they normally look after, or there's travel restrictions. Then a lot of carers expressed concerns around COVID-19. And we heard before that what happens if the carer becomes unable to care. What about government guidelines that are difficult to adhere to? And also what we heard earlier about carers of people with dementia, that there was concerns about a sort of faster decline and how to kind of respond to these changing situations. We also heard a bit about changing in availability of formal and informal support, and perhaps in addition to what's mentioned earlier about the formal support, we found that people continued to receive unpaid support, but for some that changed from practical support to more emotional support because the families decided, as with paid carers, and I think Clarissa illustrated that quite well, some just wanted to not risk having several contacts in the house. And then also people experiencing a delay in the access to medical care and also the availability. Then financial implications were mentioned by some of the other speakers, and especially the effect on working carers with reduced services being available. And it was quite interesting having these 10 different countries that these implications seem to be stronger in systems where there's less social protection. So some of the work that Heinz picked up, I mean, even though carers perhaps not as well supported as they could be, Germany still has a relatively strong social protection system. And so they were better off than, for example, carers in the United States or even carers in the UK. Then we found some impact on carer health and well-being. And perhaps in addition to what we heard and all the themes that have been picked in previous presentations, was that some also reported positive experiences, but of course the negative outweighed. And I don't think I need to go into more detail given the really detailed accounts we heard earlier. Then a theme that I thought we hadn't really picked up in the conversation so far was the carer's adaptability. And I think that's something that's very impressive and is not to take away from the negative effects, but a lot of people also said that they were drawing strengths from their informal support networks, and people were stepping in, trying to support them in ways that they could. And carers who were able to find moments for themselves and found moments to prioritize said that that actually turned things around for them and that they felt a bit better once they found mechanisms that worked for themselves. But obviously carers experience very different situations, and it's not a one-size-fits-all approach. And then one theme that we also picked up on was carers supporting people living in residential care settings, and where carers basically felt they were just kept away from the people that they would normally support because of the visiting restrictions. So there were feelings of stress and anger, feelings of guilt over the inability to visit. They were reliant basically on staff for updates and to facilitate contacts to the person that they cared for. They found it difficult to assessing what the health and well-being of the person they looked after was, and also the quality of care they received, which they normally would kind of keep tabs on through visits. Then again, concerns about treatment, if that sort of monitoring possibility wasn't there, and also the long-term implications of sustained isolation. And I think that's similar to what Clarissa mentioned earlier with the communities. So in terms of evidence of what we found, what has been done to address some of these things, well, basically technology was picked up. And I think Clarissa mentioned earlier the very problematic side of technology, and I don't want to take away from that at all, but we also found that people used it for social contacts, for peer support, which was helpful, for contact with social service providers and care providers, for the delivery of medical care, and also to getting some supplies. So even though it's a kind of contested situation, in some situations, and probably more for the carers than for the people with care needs, especially when we're thinking about people with dementia or other forms of cognitive impairment, that could actually be a helpful tool. And then financial assistance especially for working carers, but also for other carers. Carers that have access to paid leave. In England, there was the furlough scheme. In the United States, there was the stimulus checks. These were not apart from perhaps paid leave, these were not necessarily there to support carers, but they seem to have somewhat a positive impact on those situations. And perhaps, I mean, in Germany, I think Heinz pointed towards earlier this flexibility of using funds that are usually allocated for community care and having a bit of leeway of playing with some of that support money. And basically that was just a whiz through. And if you're interested in more detail, the preprint of the papers on the LTCcovid website, but the revised version should be coming out soon. But I now want to go back and stop sharing so that we can actually pause share. Now that works, I think. Right, I just need to find you all back again so that we can actually go and have a bit of a conversation in those last 12 minutes. So while I'm finding my screen again, Adelina, if there are any questions, do you want to start?
Yep, very happy to start with a question for all the speakers. And maybe we could have a quick round on, so we've seen this list of measures that we have with Klara, we've identified from the literature, and I'd really appreciate your thoughts on what you think in terms of how well they've worked or haven't in your countries. Is that a good way to start? Maybe you want to, Jayeeta, would you like to think a bit more, start perhaps with the Indian context, which may be quite different in terms of which measures may be helpful to paid carers. And Klara, as you have the screen back, I hand back to you as chair.
Thank you.
Sure, Adelina. So I think what we've been doing at NIMHANS at least is we've been contacting carers and just providing them with, if they need any support, especially as part of the study. What we were doing is getting back in touch with carers and asking them how they're doing, if they need any other support, if they want to, have any counseling. And that the advantage of this study was we also worked with ARTSI. So they provide a lot of social support services. So they, they were having meetings online, providing support to caregivers. So that was what we were doing here. Yeah.
Brilliant, thank you. Shall we move to one of the other countries? Have you had any things that you could add to? Yes,
one of the things that I was very excited to see in your review, Klara, was that the concept of how well governing bodies, whether it's at the national level or municipal level, are acknowledging the role of caregiving and what kind of social supports are broadly evidenced in those cultures. And here in the United States, we're a bit, I don't know, reluctant to articulate our values around providing care to particularly unpaid workers. It's a bit of a lightning rod for politicization right now. So I think lots to see unfolding in the new administration, we hope there, but I will also point out that here in the United States, the COVID response team at the federal level did not include a mental health expert at all until just a few weeks ago. And even now, I believe the Biden administration has only appointed a single mental health expert to that COVID response team at the federal level, which seems like maybe perhaps only half of the first baby step in the right direction. So certainly lots of work to do here in the States, and appreciative of seeing how other countries are forging the way here.
I'm very happy to come in next, Klara. I think from our perspective across the UK, I mean, as my presentation touched on, there has been a number of support measures that have been put in place by government and others to support carers and recognise the role they've played. I think the main takeaway for me is that almost all of the challenges that carers faced prior to the pandemic have been exacerbated by the pandemic, and they didn't have enough support previously, and they certainly don't have enough support now. And that's on a whole range of fronts. And I think it was striking to me that everyone, no matter what the geographical context, talked about the lack of services returning and how important they are in providing carers with breaks and support and other things. And I think it's absolutely vital that those services are reintroduced as quickly as possible and as quickly as possible once it's safe to do so. I think the recognition point is really key in the UK. The word carer itself has kind of been misappropriated during the pandemic, and we had like initiatives that were led by the government and others called Clap for Carers, where, you know, people let out of their bedroom windows in the afternoon and clap for people, but actually that was clapping for care workers in adult social care and across the NHS. And I think a lot of unpaid carers found that they were getting a lack of support and recognition, and to have that word taken away from them was quite a big deal for them as well. So I think there's, as my presentation said, a whole range of areas that we need to focus on really, really urgently as a matter of priority.
Thank you very much, John. No, I agree. I think the country, and we tried to pick up on that on an earlier report where we looked at what's available in different countries and what were policy responses for unpaid carers. And I think there is certainly more to do to see also how since the pandemic has evolved, what has changed and actually have people become more visible. But Heinz or Clarissa, would you like to add anything?
Yes, sure. I think what John said at the end is very important to the question of appreciation, of recognition. And we had the same phenomenon in Germany, the clapping for formal carers, which was received ambiguously. On the one hand, they said it's nice. On the other hand, if that it's all just clapping and nothing happened. And so we had a quite fierce debate because we wanted to introduce a bonus for nurses. 1,000 euro, a one-time bonus. And I have never seen a measurement by the government that was quite expensive and received nothing but bad temper in return, because people were not happy about that. So it was in a way a PR disaster. But what comes from our survey, also from the other survey that has been done there from the ZKP, informal carers, they felt that they were not seen and they were not recognized, and that's what's the worst thing for them. And it's not so much practical things, of course, that there were no devices available. That was a problem, yeah. But they were quite happy with their employer. So I think recognition, that's what we could give them. And what I've learned from this seminar, of course, they could move up in the priority list for vaccination. As you may know, Germany is not very speedy in vaccination. And so it will take us another half a year until everyone has get a chance. And whether you belong to priority group 1, 2, or 3, or nothing at all, makes a big difference. And that's something we should think about. Caregivers, informal caregivers, whether they should step up on the ladder.
Thank you very much, Heinz. Clarissa, did you want to comment on that as well?
Just briefly, I think most of it has been said, but just to briefly kind of reiterate again, I think from what our research, but also most research seems to show, is that people in the community seem to be forgotten. There seems to be such a media hype, legitimately, because care homes have been badly affected, but the majority of people with dementia live in the community, and so the informal carers are impacted as well. So just to kind of really give them a bit more, what's the word for it, appreciation, really, of what they're doing.
Yes, appreciation being very important coming out of this presentation, I think has emerged in all the talks, and it's great to see that coming out here as well. There is a question here from Emily Freeman. So Emily says that as colleagues, including Jayeeta, she and together with her, they will begin qualitative fieldwork in India, a significant part of which will consider the impact of COVID-19 on unpaid carers of people with dementia. And she wanted to ask the speakers what evidence needs they think are outstanding, having done their studies. What sort of questions do they think we should be asking carers?
I think there needs to be, because everything is changing now with vaccination and testing, etc., that hasn't necessarily been looked at last year. Right. That might be something you want to pick up on. How has the vaccination impacted on getting care and accessing services?
The other thing to add from my perspective is, I think because the situation is changing so rapidly, I think it will be really important to that's why we did a 6-month on study, and we got quite different findings from that. I think it will be very interesting, as Clarissa said, as the vaccine program rolls on, as other factors change, as we come out of lockdown again in the UK, how are those things changing? Are services returning, for example? I think will be really key issues. Yeah, and also making sure that carers, rather than just as a membership organisation perspective, not speaking on behalf of carers, but making sure that they're able to speak to people in positions of political power as well, I think is absolutely vital. And giving their real experiences actually is what we've been trying to do a lot.
I think our next work will look at 2 things. The first is we're trying to capture those caregivers that in the States we refer to as sandwich generation care providers, who are extending care upward to their elders and childcare to their children, or in near parent roles. So that's a particular group. And then the second is that we are including surveys of vaccine hesitancy in all of our upcoming data collection, because we're actually seeing a bit of skepticism about the when and how and who should be vaccinated. When is particularly relevant for care providers of young children, who, at least here in the States, are not going to have a vaccine available to their children for quite a number of months still to come.
Brilliant. Well, thank you all very much. That's been a very good answer. Sorry, I'm getting distracted. There is a question, one last question from Penny Booth. She's explaining some of her experience. I think, Penny, do you want to speak up briefly?
No comment, really. I think it speaks for itself. I'm an intelligent, clever woman. And this is how I get treated by the services that we have. 3 months it took for somebody to notice that the carer of an 81-year-old man with chronic obstructive pulmonary disease hadn't had a car, and yet they knew all along. They must have known, because they've just invited me to go for a vaccination. The care services, particularly the informal care services in the United Kingdom, are a national disgrace. It's nothing to be proud of, and anything less than what we have here must be absolutely appallingly bad. That's all I can say.
Thank you, Penny, and thank you for speaking about your experience. It's, yeah, I think reflects what's been picked up in a lot of the presentations, unfortunately, and I think it shows why it's really important that we keep a conversation about unpaid carers and bring that topic up and continue to do research on this. So as we're reaching the end of this webinar today, I hope we can maintain that conversation, and I hope we can come together at some point later and see how things have evolved, hopefully have some positive messages to bring, of more recognition, of more validation. And I would like to thank all the speakers for volunteering to talk to us today and for those excellent presentations that we had. So thank you very much.